My name is Dr. Rick Munaretto. I'm an endodontist, and I've been a Saddle Study Club director for 11 years. My expert tip today is on handling cracked teeth. So a cracked tooth is defined as a tooth that has one or more incomplete and longitudinal cracks or fractures that extend from the crown apically. Typically, you're going to see these underneath the marginal ridges of the tooth on the proximal surface, and most of the time they're going to be found under amalgam or direct restorations. Now, they're most prevalent in maxillary molars, followed by mandibular molars, and then maxillary bicuspids. And as an endodontist, we get consultations for these teeth all the time. And I would say the majority of these consultations are teeth that are vital, they're asymptomatic, or maybe the patient has a little bit of cold pain. And so if a tooth has a normal pulp or has a reversible pulpitis, the best treatment for that is going to be just doing full cuspal coverage alone, meaning that there's no root canal treatment that's indicated. If the tooth is symptomatic, has irreversible pulpitis or some type of pulpal disease, and we have to do a root canal, then those teeth are best diagnosed to see the full extent of the crack, really under the rubber dam, under a microscope, with a transillumination light that can be put underneath the rubber dam so we can see how far the crack goes, or we actually can use a stain inside the tooth and it'll help visualize how far that crack goes. Now, there's a lot of opinions, depending upon your specialty, on cracked teeth. But I will say, if you look at the literature and you're practicing evidence-based, the last 10 to 12 years, the majority of these quality studies show that with mild or moderate cracked teeth, the success rates and survivability is over 80% and sometimes into 90%. In fact, in July of 2019, Dr. Matt Davis published an article, a study, and it made the cover of the Journal of Endodontics. It's a great study, and he took teeth that actually had cracks that not only went subgingival, those cracks went up to 5 millimeters into the orifice of the canal. He looked at those teeth from both a survival and a success rate, and what he found was if you have a strict protocol, you can actually see the extent of the crack, perform the root canal treatment, and use a resin-modified glass ionomer up the canal over the pulpal floor. Those teeth are taken out of occlusion and they're restored in a short period of time. That he had actually over a 90% success rate at 2 to 4 years, and at 4 years he had a 96% survivability rate. So if you have any questions with the cracked tooth, it's a great time to call your endo advisor in your club, maybe have them take a look at the tooth or your local endodontist, and hopefully we can start saving more of these teeth. Thank you.